Hello, everyone. This is Katie Miller, an occupational therapy student from Rockhurst University. This presentation is over sleep and stroke. We all know there are benefits to getting quality sleep. It can help you feel refreshed and recharged, improve your immune functioning, help you fight off stress, and have improved mood and performance. The amount of sleep you need is determined by your age. Adults need around 7 to 9 hours of sleep a night. I know it can be hard to get this much sleep each night, but it is so important that you try to do so. As you can see, children and teenagers need more sleep because they are still in the process of developing. The real question is, are all naps bad? No, not all naps are bad. Try to only take 20 to 30-minute naps if you are someone who feels they need a nap during the day. Any longer can cause some trouble. The benefits of taking short naps are having improved alertness, improved cognition, and improved mood. When you take a nap that is longer than 30 minutes, you can run into some issues. You can run into having difficulty falling asleep at night or staying asleep at night. Longer naps can make you feel even more tired than before your nap because you get into such a deep sleep. This slide seems a little overwhelming, but once I talk about it, hopefully it'll make a little more sense. Sleep occurs in a pattern that is phased and rhythmic, and it's called sleep architecture. There are two main types of sleep. The first one is rapid eye movement, also known as REM, and then there is non-rapid eye movement, such as NREM. Non-rapid can be broken down into stages. As you can see, there's N1, which is stage 1, N2, which is stage 2, and N3, which is stage 3. I added these just to help you understand the graph. So stage 1 is a very light sleep and happens when you fall asleep. Stage 2 is slightly deeper, and this is when your muscles start to become more relaxed. Stage 3 is considered a very deep sleep. It is hard to wake someone up from this stage. REM is deeper than non-REM. Most of our dreaming occurs in our REM sleep. So on this graph, you can see when a person is awake, when a person is in their REM cycle, and the different stages. A person will usually progress through all three N stages before entering a REM stage, which I circled here. So if you follow my arrow, a person will progress through these stages and then go up to a REM stage. Older adults tend to have more light stage N1 sleep compared to stage N3. And you can actually see that on this graph below. So up here we have a young adult graph, and down here we have an elderly graph. As you can see, there's more stage 1 N sleep and barely any stage 3. That means this person isn't getting into a very deep sleep. This can be caused because of health problems, sleep problems, the type of medication you take, the amount of fluids you drink before bed, and so on. Back to these graphs, notice the differences in patterns between a young adult and an elderly person. Look how much more often an elderly person's cycle goes up and down compared to the one above. Look how much more awake time there is. So if you follow it along the top, that's how often someone is waking up. Compared to a young adult, there's barely any awake time. A disruption of the sleep-wake cycle can greatly affect the quality of sleep a person gets each night. Disruption of this sleep cycle can be very common after suffering a stroke. Poor sleep can slow recovery. Quality sleep has many benefits, especially for stroke survivors. Getting a good night's sleep supports neuroplasticity, which is the brain's ability to restructure and create new neural connection in healthy parts of the brain, allowing stroke survivors to relearn movements and functions. Some common sleep disorders that are associated with someone having a stroke include sleep deprivation, sleep apnea, insomnia, and restless leg syndrome. These can all have negative impacts on recovery. The next few slides, I will talk about some of these disorders. Sleep deprivation is defined as not obtaining adequate total sleep. It can be caused by things like stress and anxiety, poor sleep hygiene, irregular sleep schedule, consumption of alcohol or stimulants, pain, medical conditions, or frequent urination. Sleep deprivation, which is when you are deprived of sleep, can have short and long-term effects. Some short-term effects include anxiety, forgetfulness, memory impairments, and distractibility. Some long-term effects include high blood pressure, heart attack, stroke, obesity, and poor quality of life. This is why the amount of sleep you get is so important. The prevalence of sleep apnea is high in stroke patients. It is estimated to be between 50 and 70% of patients who have it. It causes an interruption in your breathing while sleeping. It can be present before someone has a stroke, worsen during the acute stage, and persist after the acute phase. So there are two types of sleep apnea. There is obstructive and central. Obstructive sleep apnea occurs when your upper airway gets partially or completely blocked while you sleep. This type of sleep apnea seems to be the most common and more relevant type. Central sleep apnea happens when your brain does not send the proper signals to the muscles that control your breathing, and it is less common than obstructive. Some symptoms of sleep apnea include brain fog, high blood pressure, anxiety, depression, and obesity. Here is a visual of having an obstructed airway. We'll begin over here, though, with a non-obstructed airway. As you can see, where I highlighted in green, you can see the airway is nice and open and there's a solid flow of air down the throat. This allows your body to properly inhale and exhale the oxygen it needs. However, when someone has an obstructed airway, as you can see here, again circled in green, there is a blockage in the airway. This can happen when the tongue falls back and blocks the airway. See how there's not as big of a flow as oxygen flowing through there? There are different kinds of treatments for sleep apnea, and it is up to your doctor to decide on which is most beneficial for you. Positive airway pressure machines consist of wearing a mask over your nose, or both your nose and your mouth during sleep. It supplies air into your throat to prevent the airway from collapsing. Some include a CPAP or a BiPAP. As you can see on the right in the picture, that is a CPAP. Oral appliances are also an option, and that is similar to wearing something like a sports mouth guard. About 70% of people with obstructive sleep apnea are considered overweight or obese. Losing weight is known to help improve sleep apnea. There are also different types of surgical options, and there is also sleep positional therapy, which can help reduce airway blockage by changing the position you sleep in. Your doctor will let you know more about these options if you have sleep apnea. A sleep study is a test used to diagnose sleep disorders. Different types of sleep studies are available depending on one's symptoms. Most are done in a sleep lab, but for mild sleep apnea, you can do a sleep study in your own home. A test can record things like brain waves, heart rate, oxygen levels, as well as eye and leg movements. This picture shows a sleep study setup. As you can see, there will be different things attached to your body and even a microphone that can record your snoring. If you are someone who struggles with their sleep or think you might have a sleep disorder, like I've said, be sure to reach out to your doctor. There are different factors that can determine a survivor's prognosis for recovery. Discovering if you have a sleep disorder and managing it can greatly improve your quality of sleep and quality of life. Have efficient treatment and ensure you are getting enough N3 stage sleep, the slow wave sleep I talked about earlier. If you feel you are not getting quality sleep, again, talk to your doctor. Here are some ways you can improve your quality of sleep. Have better sleep hygiene. This means going to bed and waking up at set times and having nightly routines. Improve your sleep environment. You can do this by having blackout curtains, using white noise, and ensuring your room is a cool temperature. It is recommended that you stay off technology about 2 hours before going to bed. Maybe try reading a book instead. Always make sure you have a comfortable bed. Obviously, nice beds can be expensive, but maybe it might be worth the investment when it's something that you use every single day. Have an earlier dinner schedule. It's important to avoid foods that cause indigestion and heartburn. Be sure to balance the amount of fluids you intake during the evening. This will help decrease the amounts of trips to the bathroom at night. Here are the resources I used, and thank you so much for listening.